McInerney from Croaky here, and we're at the NDIS Mental Health Conference, and I'm speaking here with John Brogden, who's just given the opening address here. Thank you very much for taking the time.
Thank you.
You talked about a whole range of issues there in a very quick time. But what's your verdict really on how the NDIS serves people with mental health issues at this point?
Well, it's better than nothing, but it's very undercooked. The fact of only 64,000 people being eligible for services doesn't even get close to the millions of people who need services for mental illness. So it's a start, but it's not anywhere near good enough. And my message to this audience is don't be happy with the story or the spin or the offer of we've started, we'll get there. We need to start with where we need to get to, not start and run a journey, because people will miss out.
So what's the step to do that? Where do we go with that?
Well, I think there's a lot of public pressure that needs to be applied, and loud voices and loud action. This continues to be the problem for mental illness, that we get underfunded, particularly as a proportion of the burden of disease. And, people don't wait days and days if they have a car accident, and they don't get discharged early. And in many cases, people who are quite highly suicidal and may have had attempts can struggle to get into particularly public hospitals because there aren't enough beds. Mental illness is not an elective surgery. It's an acute situation for many, many people. And the same applies for NDIS. We're the poor cousin, and whilst it's better than nothing, and I really do credit Bill Shorten and Julia Gillard for getting it going, it needs a lot more.
Now, you talked about how we've never had more money for mental health, we've never had more awareness, and yet the suicide rate is still so high. How do we balance that? You have some ideas around that?
Yeah, well, the first thing is it's shocking, it's sad, it's demoralising that there's so much money being spent, there's so much focus on it. Organisations like Lifeline do so much work, and many, many others. Yet the numbers are going up, and not slightly. They went up 9%. The ABS says the largest year-on-year increase on record. So I put forward a proposal that we need targets, and we need to set a target of a 25% reduction in suicide over the next 5 years. We set targets for everything. We set targets for recycling. We set targets for reduction in physical illnesses. Why not mental health? And I'm not just arguing the government has to fix these problems. This has to be a community-led campaign to fix these problems. And it's easy just to say we need more funding. Sure, we need more funding, but we need more awareness. If 8 people were drowning every day in Australia in pools and beaches, there would be a very short, sharp reaction. We've got 8 people dying by suicide every day, and we've got a slow burn reaction, and we need more. So I'm in this sort of balance of saying we've come a long way and we should acknowledge we've come a long way, but I'm getting very angry about the fact that I think the distance between where we need to get to seems to be stretching out.
So with that, how do you then respond to the Premier's, in Victoria, we're in Victoria at the moment, the Premier's announcement of a Royal Commission, if they get back in government, into mental health, and the Productivity Commission inquiry? What's your view on them?
Well, I know there are some people who think the Royal Commission's a gabfest, and there are others who think it's necessary. I don't particularly have an opinion. All I would say is the mental health sector needs to use this for exactly what it is, which is another opportunity to highlight where we're going wrong and where we can fix mental health problems, particularly the gaps and the lack of connectiveness. I'd also encourage the government not to go for a judge. You don't have to have judges chairing and running Royal Commissions. 4 of the 5 Royal Commissioners in the Child Sexual Abuse Royal Commission were not judges. So I think it doesn't have to be a judge. It needs to be somebody who is acutely aware and has a very clear understanding of what mental health is and isn't.
Any suggestions?
No.
Now, you've talked about your lived experience, and you spoke about it here, and that you had a very public mental health crisis 13 years ago, but that you returned to hospital last year, and it wasn't a happy experience.
I had a recurrence of my depression. It's managed well by medication and counselling and hopefully lifestyle and discipline, but things got out of control. I was a little taking on too much effectively, and I found myself back in that black hole again, and it got worse. It often gets worse before it gets better. It got worse, and I ended up putting myself into hospital, my local hospital on the northern beaches of Sydney, and when I was discharged, which was 18 months ago, I didn't receive a telephone call. So I've been waiting 18 months for a follow-up telephone call. Don't blame the staff, but the system's wrong. And the greatest indication of suicide is a previous attempt at suicide. So we know people leaving hospitals, private and public, clinics, with having had a suicide attempt or having severe suicidality. We know that there's a high chance of them trying to take their own life very soon thereafter, and we're not following them up. That's just bizarre and absurd.
And you talked about that as an equity issue. You said that you're well served, you have family, you have support, and you have contacts. What was your concern there?
Well, I'm lucky. Life's been reasonably good to me. I have a loving wife and family and friends, and I have means to look after myself as needed through private health insurance and the like. Many people don't, and for those who don't, I mean, if I was in that situation of having no family, having no friends, and maybe I burnt my bridges, doesn't matter, and having no money, and I left that hospital without any follow-up, the situation could have been much, much worse, and it could easily have ended up in a suicide. So we've I mean, it goes without saying we have to do much more, and as I said earlier, I'm getting angrier as we move on that we're moving too slowly, and we get bits and pieces here and there. We get some good funding from time to time. I think the media are very responsible in the way they report suicide. I think part of the missing element too is the message of hope, that people can come through very traumatic episodes. They can live fulfilling lives. I don't say a normal life, because my normal life's different to your normal life, but a fulfilling life with treatment for mental illness, just as I could be describing to you diabetes. You know, people with diabetes, if they look after it, they eat the right stuff, maybe they're on medication or insulin, they exercise, they can live a very fulfilling life. The same applies for mental illness, and to the best of my ability, I live a fulfilling life. Sometimes it goes off the tracks, but I do my best to live a fulfilling life. And that's the message we don't get out. I think people, for all the right reasons, particularly with suicide, there's a dark pall that comes over the discussion of suicide, when we need to punch through with a message of hope that suicide's preventable. Choose life, and that's not a moral or values or religious-based judgment. We need to send a message that there's more to live for than to die for, and to try and get people through that point and get them back on track again. It sounds really easy. There's a lot that goes into making that happen, but if there is a message of hope, that there is a way through and a way to keep going, I think that combined with the message of help and hope will make a difference. Some won't hear that message. They'll be so distressed and so traumatised, but some will, and will save more lives.
Thank you very much.